everyone. Welcome to A Healthier You After 40. We are connecting to create better health for our next chapter. And perhaps you will find your answers to your health concerns that you're looking for in our talk today with a dentist. I'm Linda Lukovic, your host, and we are, through the summit, we've seen just how interconnected health can be. So our emotions, our energy, our physical body, our thoughts, our passions, they all play a role in creating a healthy body. And so today we're going to discover just how much our oral health connects to our overall health and vitality with a discussion with the inspiring Dr. Inoue-Cheng. So welcome, doctor.
Hello there. Thank you so much for having me over. I feel honored to be part of this summit.
Great. Yeah, I'm excited for our interview today. So I'm just going to do a quick bio and then we'll hop into our questions. So Dr. Inoue-Cheng has helped her patients achieve their oral health goals over the past 28 years, starting as a dental assistant as a teenager and later as a dentist with a whole body holistic approach. Doctor is one of the founders of the Canadian branch of the MDIB, Mommy, Dentists in Business. It's a network of over 9,000 dentists across Canada and the US that focuses on professional advancement and knowledge exchange for dentists. I love that. So she never stops learning and improving her skills. Aside from being a full-time dentist, Dr. Inoue-Cheng is a mom of 2 teenage girls and 2 fur babies. She enjoys cooking, crafts, reading, hiking, yoga, meditating, and traveling. Welcome. So do you want to do a little bit of introduction yourself and tell everyone a little bit more about you?
I couldn't describe myself better than you already did.
Okay.
I think I'm one of the kind of nightmare to most of my staff, because every weekend when I attend any continuing education or conference, I come back on the next Monday full of energy to implement new techniques or new stuff. I'm one of those. I love learning. I really believe that whatever we are doing today is the best for today, but tomorrow is a new day and it's always a new way of looking at health.
Yeah.
So I love learning. I never stop learning.
Yeah, and that's exactly what this summit is about, right? So
yes,
I'm sure everyone's really curious to hear, you were a dentist at first, and then you eventually broadened into holistic dentistry. So what made you do that? What made you sort of shift your practice?
I think, as you mentioned, I've been in dentistry for quite a long time. I started as a dental assistant. I became a dentist. Then not too long after, I decided to move towards a specialty root canal specialist.
Okay.
And then dentist again, because I moved from Brazil a while back. And while I was working as a GP, a general practitioner, I realized that it wasn't about my skills, my hand skills. I was missing something. Mm-hmm. I realized that many of my patients keep coming back with dental disease, decay, gum disease, broken teeth, no matter their oral hygiene. Mm-hmm. And I realized I was missing a piece. That's when I started thinking that I have to learn more. I have to really connect things. And I was very lucky years back to be introduced to a really, really wise lady from Texas who opened my mind. I realized that I was missing a big chunk of the issue in oral health, breathing. Pretty much breathing. And that's how I enter in the holistic approach or the biological approach of dentistry. Once I start connecting things, I couldn't stop. I couldn't look back. And that's how I enter my biological dental field or holistic field, how some people call.
No, that's so interesting. Because I know, like, one of the things, if you've ever been to nutrition school, holistic nutrition, one of the things you study is oral health and how it's connected to like diet as well, with the Weston A. Price. Did you do any of that in your practice?
Price, yes.
He's super
Dr.
famous.
Price.
Yeah, but it's so interesting. Like, he went and studied all around the world because he was realizing that people are getting a lot more dental caries, I guess they call them, and the jaw lines were starting to get a little bit more defined, more narrow. And so he kind of linked this change in dental health to nutrition. So that was pretty cool too. So yeah, so it is all connected. It really is. So I'm sure everyone's wondering, so like, what do you typically find in, especially people over 40, maybe in their 50s, 60s? Are there certain themes that you see in people's health in their mouth?
Absolutely. I think one of the patterns that I see quite often on my 40 plus years old patients, and especially females actually, Clenching and grinding.
Okay.
They've been dealing with TMJ disorders for decades without their knowledge. And I always like to compare, think about the soccer player with their knee or the runners with their hip. It doesn't happen over the night. It takes years and years to start showing symptoms or signs that would call your attention. You would seek for help. So many of the 40 plus years old patients, they come to my chair seeking for dental treatment, but they don't realize everything is connected. So the pattern that I see very often, they bring to their medical history to the table, it's anxiety, depression, aches, all kind of aches, headaches, migraine, neck pain, shoulder pain, hip pain. But again, they don't realize it's all connected.
Yeah.
The size of their mouth, the shape of their mouth, like Dr. Price explained so well to us, is to do with their lifestyle, the way we are eating, the way we are stimulating the growth of our skeletal. Over the years, our health take a toll, right, for all this. And that's the pattern that I see most of my 40 years patient. They've been dealing and coping with that mouth without their knowledge. It's something is wrong.
Yeah, that's so interesting. Yeah. So, and, you know, I imagine with some dentists, you would go and they might notice clenching and maybe they don't do anything about it. Maybe they do, but how would you approach that if you notice that in someone?
I wish I have a very straightforward answer for that, but it's a little bit more complex. Clenching and grinding, for instance, it's a cope mechanism that we evolve to cope with lack of proper breathing. Now, the lack of proper breathing is to do with the size of your mouth, or is it to do with the muscles around your face, tongue, cheeks, tongue tie, for instance, or a lip tie, or is it only to do with your nose? So there are a few things that we have to put together when the patient is in the chair. We go over medical history, go over all the symptoms or all the signs that sometimes they don't connect. We can do from just breathing training to change the size and shape of their mouth to correct that kind of a problem. So it could be a very simple treatment to a more complex treatment, depend patient by patient.
Right. Oh, that's so interesting. So in someone that's not sleeping, for example, what do you generally see in their mouths? Is that the tension that you see? Or?
Those are the aches that patients come in complaining to me. Usually that's how I would ask for patients. If I see signs and symptoms inside of their mouth relate to clenching and grinding, then I would ask, hey, do you feel any sore on your face when you wake up? Most like when you chew too much gum and you feel like that tiredness on your cheeks. Do you feel like in the morning? Oh yeah, I do. Now that you ask, yes, I do. How often do you have those? You know what? I think maybe every morning or every now and then when I'm stressed. I love when they bring this word, stress. Who's not stressed, right? We are all stressed. 40 plus years old. Oh my gosh, we're struggling. We are struggling with the work-life balance, right? We are struggling to be a mom. We are struggling to be a wife, a daughter, a friend. How about work? We are all struggling. So when they bring the word stress to me, my face light up. Yes, we all have stress in our life, but that's not the kind of stress that would cause clenching or grinding. It's the lack of proper breathing. It could be daytime or just nighttime. My observations with female patients on that kind of age, they bring their cope mechanism, their night cope mechanism, clenching, grinding, to daytime. So many of them, after we meet, they start paying attention. And when they're in front of their computer or when they are doing their workouts, they're clenching because that's how they are coping to breathe properly. They clench, they bring their tongue forward, and now they're breathing through their nose because that's what their mom taught them. Close your mouths. Right? So it's fascinating to see how everybody will go to different ways. But clenching and grinding, it's a big deal for sure. And many of the patients don't even realize they do. When they sit in the chair and they show them all the signs in their mouth, they go like, wow, how come nobody never told me? And I always tell them, unfortunately, medicine, dentistry evolves. Not all of us has been trained to look for those signs.
Yeah, that is so interesting. Yeah. Okay. Yeah. And I think awareness is huge. It sounds like a simple
Mhm.
thing, but you're right. Like most people are walking around in like a high level of stress, but they have no idea because maybe they've always felt that way.
Mhm.
And so they don't even know what it feels like to have a relaxed jaw. Yeah. So
Exactly.
yeah. So is there anything else you tend to see in that population? So sleep,
Um,
anxiety.
Very important, and I think it goes to your corner as well. Nutrition. It's a
Okay.
big deal for me. Many times, all my patients are not breathing properly, and that mess up with their bacteria in their mouth.
Right.
So
Okay.
whoever is mouth breathe, let's go back. Whoever is clenching,
Hmm.
and I always tell patients, you don't clench every night, all night. But if you clench, you're also mouth breathing. It's not normal to clench. In
Right.
between, every time you clench, you're mouth breathing. If you're mouth breathing, it means that you're changing pH of your saliva. And if you're changing pH of your saliva, you most likely have different or more bacteria than you're supposed to have in your mouth. And guess what? The mouth is connected to the body,
Hmm.
meaning nose, stomach, guts, they're all connected. If you mess up with the quality and quantity of bacteria in your mouth, well, everything else will suffer as well.
Yeah.
So I see more cavities in
Okay.
patients like that, no matter their oral hygiene. Those are the patients that keep coming back. Well, I brush my teeth, I floss my teeth. Oh, I even use water pick, but every time I come here, I have a decay.
Hmm.
My husband does nothing and he's fine. So those
Yeah.
are the kind of patterns that I see quite often.
Okay.
Another very interesting piece that patients still get in shock when I
Mhm.
explain to them. Some of the patients come back often for their hygiene appointment, their dental cleaning, and they keep asking, I don't know what else to do because the buildup that I see in my mouth, it happens so quickly.
Oh.
Well,
Hmm.
then we have a big conversation. How about your diet? How about
Okay.
your guts? It's also to do with your guts. Maybe you're not absorbing vitamins the way
Mm.
you're supposed to. Now, all that extra mineral that is supposed to be working to make bone, or it's hanging on your saliva, and that's how you get the build up so often. Very, very common for my 40 plus years
Yeah.
old patients. Um, it's
Mhm.
not about what they put it in, but how they are absorbing everything,
Absorbing
right?
it. Yeah. And we've definitely heard that from some of our speakers as well, that whole gut health connection. So that is so interesting that you can see it in your
And
mouth.
it's
Yeah.
amazing that
Yeah.
everybody's like looking to the same kind of way nowadays.
Yeah.
And I know there's a lot of information out there. We are living in a world that it's so easy to find information, but I always encourage my patients, yes, please go out there, look for answers, but bring me questions. Bring me questions so we can make sure that it's to you, because
Mhm.
every body will react in different ways.
Yeah.
Maybe I will see build up in someone's mouth, but in another mouth I will see ulcers, afters, or
Ah.
herpes, or
Hmm.
it's very interesting to see how the body
Okay.
will take.
Interesting. What about like cankers? People getting cankers
Yeah.
a bit more often. Yeah, that indicates a digestive issue, I guess. Or
Same with the breathing.
oh.
If they're mouth breathing, they are changing their
Mhm.
flora, their
Okay.
bacteria.
Yeah.
And well, for example, I always tell patients that we can find health providers, we can find any numbers we want on the research to prove to
Mhm.
our patients what they have to do. And I'm kind of a little nerd. I like science.
Okay. Yeah.
And out there, I can find from 40 to 70% of the OSA patients, obstructive sleep apnea patients, has
Oh.
some acid reflux going on, GERD,
Oh,
and they are
yes.
not even
Interesting.
aware of that. So that goes with the canker sores that you mentioned. So it's all
Ah,
connect, right? So many patients
interesting.
has no symptoms. They don't
Yeah.
have that bad taste in their mouth, or they don't have that heartburn that they are
Mhm.
aware of when you have acid reflux. But they do have, but they just don't know. Now they open their mouth and I see erosion or their teeth. I can even tell which side of the bed they sleep if I see
Oh,
erosion.
that's on which side of their yeah,
Yeah.
okay,
For
interesting.
example, if they're sleeping on their left side, I most likely will see erosion on their left side teeth.
Really?
Or
Oh, okay, that makes
yeah,
sense. Okay. Yeah, yeah.
yeah,
Okay.
it's well, teeth don't lie.
Yeah. it's not just the sagging skin. It's like,
Yeah, pretty much.
Yeah.
You got it.
That's right. Oh, that's so interesting. Yeah. You know what I'm curious about actually is like the whole X-ray thing. Like I know there's definitely in some health circles, they talk about X-rays. You don't want to do too many X-rays because the radiation. What are your thoughts on that?
Oh my gosh, I love that you touched that. I'm actually on the other side.
Okay.
I like to be very least invasive, but I don't have X-ray vision.
Yeah. Okay.
And yes, patients get lectures from me when they come to meet me at first, because they need to understand what I see. What really makes me wake up every single morning, it's the fact that I can empower my patients. I can educate my patients to make their own decisions, because at the end of the day, it's their mouth, their health. Yeah. I went 4 times to dental school to do what I do, but I have to translate in minutes. Now, when I look at X-ray, I need seconds to see what I have to really check and figure out if it's a candidate for whatever treatment. But if the patient understands what I see, it will be easier for them to make a decision. Right. So I am in favor to do X-rays. I am in favor to do 3D image, CBCT. Okay. Again, that's how I will figure out if I have a candidate for whatever treatment. Very recently, I always say that in my practice, I have 3 different kinds of patients. I have patients who come for dentistry. I have patients who come for the whole body approach. Mm-hmm. And I have patients who come for my specialty, sleep apnea, airway. Yeah. And so I got this family, mom, dad, and a 6-year-old kid. They came to me, very high dental IQ, very high health IQ, just for the dentist. Now, on the medical history, kid has many breathing issues. So as I go over with my new patient exam, my head and neck exam, which by the way, amaze me every single time I check their head and neck, and they still in shock that I do this. Yeah. How come dentists do all this? Well, I'm the first one checking for oral cancer. Yes, I have to palpate your neck to figure out that kind of stuff. Anyway, so this family came to me and on their kids' medical history, all the breathing issues. Of course, we focus a little bit on that to figure out all the decay, all the breathing, all the skeletal development. Now, dad made sure that he's not looking for none of this on his own. He just want to make sure everything is fine with his teeth. He just broke 1 tooth. He needs to replace that tooth, but everything is fine. I mean, his wife keep complaining that he snores a lot, but other than that, everything is fine. Now I check on the medical history, and he had a stroke 4 years ago. He's 44.
Whoa.
Again, no X-ray vision, right? Mm-hmm. I check his mouth. He has 32 teeth in his mouth, meaning he has all his teeth in mouth, but his mouth is so small. So small. Mm-hmm. When he opens his mouth to me, it looks like his tongue is huge. Mm-hmm. The tongue is not the problem. It's the size of the arch, the mouth. He barely can fit that tongue there. Now, if he cannot fit that tongue inside of the oral cavity, where is his tongue going? To the back.
Oh.
Okay, fast forward. We move forward with dental or skeletal, orthopedic, orthodontic treatment to the kid. Now, once I get back all the 3D image X-rays from the kid, I ask dad, hey, based on your kid exams, what about we do a 3D image of your head so we can check your airway? Guess what? He barely have any space on his airway standing up. Now he's a very fit guy. Besides the stroke 4 years ago, he has no medical history, healthy. It was a surprise.
Wow.
Now, he did have a sleep test, which came clean. Actually, he had 6 rounds of sleep tests. None of them accused that he has sleep apnea. Oh. Now, I think many of us health providers, in name of not doing all these exams, X-rays, blood tests, so on, we are missing big pieces of the information that we need to make a proper diagnosis and consequently treatment plan. And I always tell patients, please go for a second opinion, go for a third opinion. As long as you get the same diagnosis, there's so many treatments out there for the same problem.
Right.
You're going to be the one choosing how you're going to be treated, but make sure that you understand the diagnosis. And if you need a second, a third, or fourth opinion, go for it. It's important, right?
Yeah. That is great advice.
Yes, I am in favor of doing X-rays and all the diagnostics properly, because that's the only way I can make a proper diagnosis.
And more quickly, right?
Yeah. Oh, yeah. I'm sorry, it's a long answer for that, but
no, I think that really helped us to see how you work with your patients. And, you know, it'll be interesting. Actually, I could probably do a poll later in the Facebook group to see how many people have ever had their neck palpated by their dentist. Right? It'll be kind of fun to see the results there, because that is really, no one's ever done that to me at my dentist. So
years back, it was so funny. I had to see my boss's wife as a patient. He was like, oh, can you see my wife? And I was like, yeah, of course. So I was palpating her lymph nodes, and she left the room telling everyone in the office that I do massage. So from there, I make this joke when I meet patients for the first time, and I say, hey, I'm going to do a little massage on your neck. Oh, it makes it a little easier for them, right? But,
oh, that's so funny. Oh, that's really, because I guess you don't really want to tell them why you're doing that, right? For the fear.
I think many of the patients nowadays, they are craving for knowledge. They are craving for this kind of approach, the more holistic. They want to understand exactly what's going on. I don't have to say the C word, like I'm looking for cancer, but I can say that I'm looking for any signs and symptoms that I can help their physician to take care of them.
Ah, that's very cool. You know what I'm curious about too, actually, is bone density. Can you see people's, like, in their jaws? Can you see anything around like bone loss or? Yeah,
absolutely. And especially if we are talking about 40 years of age, it's a time that we female patients, we started having decrease on our hormones. And again, it goes with the guts. If we are not absorbing vitamins properly, no matter how much we put it in, plus that hormones that is not on our favor, yes, we will lose bone. Not only bone, but teeth become a little bit more brittle. So it's very important that we check. If I see a pattern of decay, no matter what we do, we will check that. I love working with functional medicine doctors or naturopath. I usually send my patients to seek a second opinion, and believe me or not, it's always there. Low levels of vitamin D, low levels of K and D. It's impressive.
Wow, that's so interesting. Wow, you've definitely given us a ton to think about. Are there any other scenarios that you think, you know, we should be aware of when it comes to our dental health? One thing I'm curious about is, like, you know, as we get older, sometimes we think we don't really need to go as often to the dentist. What's your recommendation on how often people should go?
I guess I would start with babies. Many of the patients get a little, if we're talking about the 40 years of age, those are the patients that come with young kids for me, right? And many of them are just starting their families. And they get in shock when I say that I would like to see their babies before they have teeth, because that's the time that we can check for tongue ties, lip ties. They're struggling to breastfeed their kids, and they are not aware why. Or their kids are struggling to sleep, or they're getting sick too often. Or more than that, prevention. I love prevention. I think I'm the holistic kind of dentist because I start in the right way, prevention. Like I said, I like to empower my patients. If they come with babies, then we will talk about diet. We will talk about how we can stimulate their growth, their skeletal growth. Now, if we are seeing kids, then of course, we are just keeping up with that. Now, if I see a 40 years old patient, I love that age. I'm going to be honest with you because I'm one of them. I think we are more okay on our own skin. We don't have any trouble saying out loud if we don't like our teeth or our smile. And I just would say to them, it's never too late, right? We can change the shape of your mouth. We can change your smile. We can change the shade of your smile. It's never too late. And I love it because this age, they really know what they want. So it's kind of cool to work with this kind of age. Now, how often they should come to the practice, to a dentist, depends. If they have gum disease, and we all know it's like well-known knowledge out there, gum disease leads to cardiovascular disease, Alzheimer. There are like so many diseases that it ties goes hand in hand with gum disease. So those patients, it's not about oral hygiene only. They need to come to a dental practice to keep up with the good work more often.
Right.
Now, depending on which stage they are, it might vary between 3 months to 6 months, every 3 months and every 6 months. Usually a regular patient twice a year.
Okay. Okay. No, that's really good to know. Yeah, I think that's really helpful. So, oh my gosh, that was so interesting. If you had to like pick one thing that people can do right away, besides like brush your teeth and floss, the regular stuff, if you had to pick like one habit that you think like everyone should be doing right now, can you think of anything? Or like
it will sound crazy. It will sound crazy coming from a dentist, because I think any other dentist would say brush and floss. I think that's a given, right? We all know that we should brush and floss. So I would say breathe. Make sure you're breathing properly. There are tons of information out there, many different techniques. You can start with a little meditation here and there, or you can do boutique technique. Again, there's so many techniques. Just make sure it's one piece of your health. It's not all, but it's a good way to start. Breathe.
I love that. I agree. We all need to breathe more deeply. Yeah. So thank you so much for joining us today. Do you want to let everyone know about the exciting contest we have on the go?
Oh yeah, absolutely. I think for our 40 years old patients, what they are looking for, making sure their teeth looks as white, as bright as when they were on their 20s. So why not giving a free whitening for our listeners? I love that.
That's amazing. That is huge value, you guys, if you don't know. So that is a really exciting prize. So this will be for our local watchers, friends in sort of Oakville area. So we'll do something fun for everyone else later with the other speakers. But thank you so much for joining us. You've certainly given us a ton to think about. I know everyone's going to be like looking on their phones and making dentist appointments right now. So thank you. Thank you so much. And we're actually going to be jumping on live together later on in the Facebook group for a Q&A. So definitely join us there and we can continue the conversation. Thanks, everyone.
Thank you
for joining us.